Good afternoon, Cedarfield family, residents, team members, families listening tonight, Pinnacle Advantage members. Thank you so much for, again, listening tonight for this information about our COVID-19 Evolving Preparedness Plan, some data that we have been collecting over the last 2 weeks. We're going to talk a little bit about the vaccine rollout. Matt Dameron has some great news to share. Yours truly will give a little brief synopsis of the governor's 2 p.m. briefing just moments ago. Sharon Brown is here to talk a little bit about housekeeping, and then I'll come back a little bit later and talk a little bit more about some other operational updates around Cedarfield, and then we'll round out this live chat here on January 6th with some frequently asked questions. So if anyone has questions that they would like us to address here today, please feel free to text on the phone number listed here, or certainly feel free to email at mshaw@pinnacleliving.org, and we'll address your questions just as quickly as they come in. So first, just the current situation by the numbers with COVID-19. In the number one metric, and we heard the governor say just moments ago, it's still one of the main metrics that the Virginia Department of Health and the Commonwealth are using to gauge where we're at, which is the 7-day positivity rate. Interestingly, over the last 72 hours or so, I have received 15, 16 different texts or emails or phone calls asking if we could define what the 7-day positivity rate is. So for those of you that already know that definition, great. If you can just bear with me during that second segment, I would appreciate it. If 15 people have a question about that, hopefully this is just general learning for everybody, or a reminder of what that definition is. So speaking of the 7-day positivity rate, in the Commonwealth of Virginia, our 7-day positivity rate is 16.7. Just a couple days ago, it was 15.4. Here in Central Virginia, we have a slight uptick of 19.2. From Monday, it was 19. In Henrico County, it's gone up a full percentage point. We are now 13.5, which on Monday, January 4th, it was 12.4. In Richmond, we went from 11.3 to 12.0 today. And in Chesterfield went from 16.0 to 16.3. So those 5 metrics that we've been using have all increased again over the last 48 hours. And again, Henrico County has gone from 12.4 to 13.5. Interestingly, as the governor was talking in his briefing here at 2 o'clock, he mentioned the 7-day positivity rate and was talking about how the epidemiologists of VDH are looking at the data that's coming in, and we should expect to see a continual increase in the 7-day positivity rate all the way through Valentine's Day. So let me actually take a step back, since several people have asked, what is this 7-day positivity rate and why do we use it? So the percent positivity rate is exactly what it sounds, really, in that it's the percent of the coronavirus tests performed that are actually positive. Or, for the math interests out there, it's positive test divided by total test times 100%. I guess is an easier way of saying it, for those of you that are interested in numbers. The percent positivity rate is sometimes called the percent positive rate. It's sometimes called the positivity rate. Here at Cedarfield, as we've been going on these live chats, we continue to say it's the 7-day positivity rate. And it helps public health officials answer two really main questions. Those two questions are the following. And I called the lead epidemiologist on Monday and asked her, why do you continue to use this rate? And here's the two questions that they want answered to. What is the current level of COVID-19 transmission in the community? And are we doing enough testing for the amount of people who are getting affected? So that 7-day positivity rate helps the epidemiologists answer those two questions. The percent positive will be high if the number of positive tests is too high, or if the number of the total test is low. So the higher the percentage suggests that there's a higher transmission and that they are more likely more people with coronavirus in the community who have not even been tested yet. So that's a really important point that they wanted me to highlight. The percent positivity is a critical measurement because it gives VDH an indication of how widespread the infection is in an area where the testing is occurring. So we're using the testing is everywhere in every county, but they use this 7-day positivity rate often in years gone by with the flu to see how the flu is spreading throughout the community. So hopefully that definition helps folks. Thank you for the 15 people who were very interested in what that definition is. If anybody has any further question about it, please feel free to call down to the administration suite and we'll go through your questions. The data here at Cedarfield, I'm going to first start off with the health center. In the north neighborhood, that neighborhood is green for residents and team members. In the south neighborhood, that dashboard is green for residents and team members. And in central neighborhood in the health center, we had a slight change over the last 24 hours. We now have 2 positive cases in the health center. And those 2 residents seem to be doing well here in the last half hour as I received word from one of the nurses upstairs. So 2 positive cases up in our central neighborhood. We have 5 residents in total in healthcare that are under quarantine because they went out of beyond the gates of Cedarfield here over the holiday season. So as an extra precaution, that was the guidance that we were suggested to use through the Virginia Department of Health. Assisted living, our dashboard is green for residents and team members, although we do have 6 residents who are under quarantine for, again, the same reason that they went out during the holiday season to visit family, but those 6 residents are doing quite well. No signs and symptoms with any of those folks, those residents that are quarantined in assisted living and or the health center. In Sunshine Plaza, our memory support area, the dashboard is green for residents and team members. And in the main building here for independent living, the dashboard is green for residents and team members. In the cottages, there are 2 positive cases with residents, and there are 0 positive cases for any team member that works in and around independent living. So those are our numbers here for Cedarfield. If anyone has any questions about that data, please feel free, like I said, to call down to administration, and we'll work through your questions. Secondly, I just wanted to give a little synopsis of the governor's 2 p.m. News conference here. He was very optimistic, I thought, about where Virginia is at, very detailed. He did talk about doing the next best thing for ourselves and for the good of the people in and around us. We mainly around this wearing masks and good infection control and staying 6 feet apart, all the things that we've been talking about through our Cedarfield shared values. He did talk about how the case counts have they are now today 4 times as higher than we were in the spring in terms of counts per day of the number of cases. As I mentioned a couple of minutes ago, he did talk about how the epidemiologists expect the continual rise of the 7-day positivity rate to substantially increase all the way through Valentine's Day. He did talk briefly about the new strains of the virus, how they're more contagious, and while not located currently here in Virginia, that it's likely that those mutations are here in Virginia. Again, talked about over the last 10 months, the tools that we have. We all know what the tools that we've had that we need to do in order to keep ourselves safe. And then he went into 22 days ago, the world changed when we were given the vaccine through the FDA, which was a great day for America. He did talk a lot about the vaccine rollout in being very complex. And if you want to go back and look at his news briefing, you'll understand why he said complex. I'm not going to get into it again. He did talk about how in the Commonwealth of Virginia, there are 8.5 million people. And if every person in the Commonwealth needs 2 doses, that's 17 million doses in the Commonwealth to get through. And so it's a tall order in a very short period of time. Currently, we're providing vaccine for about 100,000 doses per week, or about 14,000 doses a day. That's our current metric. Given the supply chain, his short-term goal is to get that number up to 25,000 shots a day. Talking about vaccines in the arm, 25,000 vaccines a day. He was stressing to healthcare providers who are helping with the vaccine that one of the main goals is to make sure that no supplies go unused. And then, probably for about 20 minutes, he talked about clear prioritization of the vaccine. He talked about one phase 1A, phase 1B, and 1C. 1A consists of healthcare professionals, EMTs, folks that work, physicians and nurses, and other professionals that work in the acute care settings. And then he talked about nursing homes and assisted living communities. He did talk a little bit about how in that group alone, there are 500,000 people in the Commonwealth of Virginia that we have to provide the vaccine for. And then interestingly, he made the statistic that with the 300,000 plus deaths that have occurred in the United States, that 40% of them have happened to individuals that live in nursing homes and assisted living communities, which is why we are in that group in phase 1 to get vaccinated as soon as possible. Matt will share some of that rollout here, all of that rollout here in a couple of minutes. And then he talked about in phase 1B, specific to our population, 75 people who are 75 years of age and better, there's about 2 million folks that fit into this category, and 65 years of age and better in phase 1B. What the detail, I did not hear, I didn't hear the tail end of it, I didn't hear what the timing of that was, but I believe, listening to a couple of conference calls, that we're trying to get through 1A, 1B, and 1C through the springtime. What does that mean for independent living folks here at Cedarfield? Whether or not we can have another clinic here through Walgreens. Matt and I are still working with our Walgreens provider to see if when that can happen. So if anybody has any questions about the last 20 minutes, again, please feel free to call the administration suite, and we will answer your questions just as soon as we can. So next up is, you want to go next? Sharon Brown, our housekeeping director.
Good evening. I just have a friendly reminder for you all, just to continue to wear your mask and do your social distance while the housekeeping are cleaning your apartment or your cottage, or you get your carpets or anything cleaning for your safety and their safety. And also, I have one more thing. I will have the power washer company coming back to complete the cleaning of the bricks of the independent living. I see we have missed a couple of the bricks, but definitely we'll be back going around the building tomorrow, looking at those ones that we missed, and we'll complete by a couple weeks. Thank you. Next, David.
Happy New Year, everybody, and from the Dining Services Department, I want to thank you for a great holiday season. Thanksgiving, Christmas, and certainly New Year's celebration was fantastic. And I want to talk about a couple of upcoming events. So in February, we're going to have two things back to back, just because that's kind of how they fall. We're going to have a Valentine's celebration on February 10th and 11th. It'll be a 2-day event in the dining room, and we're going to partner with Wellness and Leisure again and have a number of different things going on for that event, so look forward to that. And then also on Friday, February 12th, quite a number of our team members will be celebrating the Chinese New Year. So we'll have a special meal planned by the staff, by the kitchen culinary team, but presented on the showcase with Otis on Friday, February 12th. So those are two events that we have planned thus far, and we're also looking at some other ones shortly thereafter. So I'll be back with updates on those. So Happy New Year, everybody. Stay healthy, stay safe, and thank you to everybody from the Dining Services Department. Next is Matt.
You have an update, or are you just listening?
Either way.
Either way? Okay. Matt's got news that they'll probably tune out after the news here.
Good afternoon, everyone. My name is Matt Dameron. I serve here as the Associate Executive Director, and I just have a few pieces of information for you concerning the vaccine here at Cedarfield. So I just want to give you really an update as to what we know right this second. Some of the information you might already know, but a few pieces are brand new. So just wanted to make sure that we're all on the same page. So first, the residents in all 3 healthcare households, and all Cedarfield team members that work here on our campus will receive the vaccination from Walgreens on Thursday, January 14th. That is the first round of the vaccine, and then the second one will happen on Thursday, February 4th. So they do have to get both vaccines, so we need to make sure that all of those people are available on those 2 dates. Just a few little logistics about that. They will start at 9 a.m. on those dates. Pharmacists from Walgreens will be here in the building. There could be up to about 6 of them that will be administering the vaccine. They'll get here at 9, start, and then they'll just stay until everyone is done. And they said that typically with the communities that they've done so far, it's been multiple hours, so they could be here the vast majority of the day. The pharmacists for healthcare will go room to room and vaccinate all of the residents in those 3 households. And a nursing team member will be with them to help assist in that process. And then for all the team members, that will actually occur, they call it a clinic for the vaccine, and that will actually occur right here in this room in the fellowship hall, where we have all the team members come in at specific times to get vaccinated by the pharmacist. The newest piece of information is I spoke to our pharmacy representative late yesterday afternoon, and am very excited to announce that we will be able to give our assisted living residents and Sunshine Plaza living residents the vaccine as well. They do, yay, and the crowd cheers. So they do have to do it as a separate, it's almost like a separate entity through the CDC, a completely separate date and a little process for us. So all of the assisted living residents and Sunshine Plaza residents will receive their vaccine on Friday, January 22nd, and the second round of the vaccine will occur on Friday, February 12th. The household leaders, or the neighborhood leaders in those 2 areas, Morgan and Shannon, will be reaching out to the residents and their family members to give a little bit more detail as to what we know right now. We don't have all of the details or logistics planned out, but we do know that. They again will come at 9 o'clock in the morning and will go room to room, apartment to apartment in assisted living and Sunshine Plaza to vaccinate those residents. So we're so very thankful and happy to announce that for assisted living and Sunshine Plaza. As Michael said, we don't have a specific date or details about independent living, and my pharmacy contact yesterday afternoon also confirmed that they don't have those details to give out at this time, but she's definitely going to keep me in the loop. We talk on a pretty regular basis about this process, so she will definitely let me know as soon as anything changes. And the one thing that my contact at Walgreens keeps telling me every time we talk, she gives me an update as to how many vaccines they've given out and if anyone has had any reaction to those vaccines. So she gave me the update. They have given out hundreds and hundreds of vaccines, just their little group that's based out of the Walgreens over here on Pouncey Track. They've given out hundreds and hundreds of vaccines over the course of the past week and a half and have had zero reactions to those vaccines. The only issue that they've had is a couple of people have had a sore arm from the injection site. So she wanted me to keep saying that over and over again to our residents, to our team members, to give them a little bit of comfort as to what happens when this vaccine is given. So that's my little bit of good news for right now.
Hip, hip. I can hear it through the doors and the windows. Hip, hip, hooray. More good news. I just wanted to take maybe 10 minutes here to talk about additional community operation updates. If anybody has any questions about anything unrelated to COVID, please feel free to text. Renee is here. Did I mention Renee is back from vacation? Can I get an amen? Renee's here taking questions. One question did come in my statistics in the earlier part of the hour are incorrect. We do actually have one team member that is positive that works in independent living. We did contact trace that person, and given where that person was from the housekeeping department, we don't believe that there is any exposure that fits the CDC's definition, so very low risk item. I did want to just share additional good news. Last year we conducted a team member engagement survey, and we hire a third party to help us with this specific survey. We try to do it every other year, and the management team worked through the results of this survey here just 2 weeks ago. I thought I'd share just some highlights of this survey so people can really understand what the perspective is from the team. If anybody has any questions about this data and or would like to learn more about it, please feel free to contact Renee, and I'd be glad to have lunch with you or come down to the office to talk through some more of this data. This team member engagement survey is 34 questions. We actually added 3 questions this year due to the pandemic. And Holleran, who's the company that we use, they have many nursing homes, assisted living communities, retirement communities around the country. Their sample size that we are being compared to is 60,000 other surveys across several hundred organizations around the country. In this past team member engagement survey, we had a 93% participation rate, which is just great. The team felt really free to share their opinion about Cedarfield through these questions. Overall, and again, anybody wants to learn more detail about it, please contact the administration suite. But overall, of those 30 plus questions, only one of those questions decreased from 2017, which is the last time we took the survey. And in fact, as the management team and I were reviewing these statistics, the fact that we were in a global pandemic and we got 93% participation rate, and the fact that most of these questions went up a 0.2 of a point with most questions is just a significant significant indicator to us preliminarily, not really diving into more of the data and holding focus groups with some of these questions. But preliminarily, the team is very satisfied with Cedarfield. We have strengths, we have opportunities. There's some questions, obviously, that are of interest to us to dive into with the team a little bit more, to understand what they need and want to make it a better place to work and to enhance, for example, communication. But overall, like I said, one question went down. Overall satisfaction on a scale of 5, the mean score is a 4.33. The highest performing question is, do you think that you will be working at Cedarfield for more than 3 years? And we scored a 4.34 on that question. The next highest performing question was, my opinion counts. I just think that that question is so relevant for many different levels, given the variety of things that popped up in 2020, and the fact that the team feels that that's the second highest question. The community cares for the residents and the team members is the third highest question. What I do counts at Cedarfield is the fifth highest question. Trusting leadership is a high performing question. Positive recognition. And then the other one that rounds out for me of significance is, I have respect for my supervisor and he or she cares about my growth. And then to round out the top 10 list for me is, I make a significant difference at Cedarfield. So great, I could not be more proud of this survey results. Again, when you think about all the things that happened in 2020, particularly with the spotlight of through the pandemic and the media, that spotlight was on our community, knowing that we have a nursing home, assisted living community here, and all of the evolving preparedness plans, the changing of the plans, the fact that we had these type of scores, we're pretty happy with it. Not resting on our laurels, of course. So we look at the survey, and we will, over the next couple of weeks and short months ahead, look at the data, hold a couple of focus groups with folks across the organizational lines, and then come up with an action plan to use the data, for the qualitative and the quantitative data, to make it a better workplace for our team. So if any resident would like to, again, review this data, please feel free to reach out to me, reach out to any of the directors, and we would be happy to walk you through it. Little construction updates. The household project, everybody sees that. I've never seen a crane as big as that crane that's out there. We are rounding the curve here, and we're on we can see the checkered flag here. Come springtime, we should have that building available to us here in operations. So they're working very diligently right now on the 4th floor with the punch out process, as they call it, looking at the finishes and working with the architect and the owner on those finishes. And so that the 4th floor is looking very well on target. The 5th floor is about 2 weeks behind it, which is what they planned. And we're targeting still a springtime opening of that building. The team and a couple of residents are working on a grand opening for that building. And with social distancing in mind, we're going to have probably something similar to a couple of these large-scale events we've had here in the last couple of months, including the Great Gatsby, where we have several several little micro grand openings so people can walk around, feel the building, ask questions about what the spaces are for, but yet do it in a very socially distant manner. So more to come about that. Speaking of the Great Gatsby, I hope everyone had as much fun attending it as the residents and the team members had planning it. Thank you to Carol Marco and Eldon Rutger for being part of our 25th anniversary action team. The two residents just at the table helping us day in and day out. The team had just a blast planning with Carol and Mr. Rucker planning the event. Thank you all for attending it. Through the lens of the pictures, you can tell the smiles on every resident's face, that everyone really had a good time. The event took place between independent living, memory support, assisted living, and the health center. And so every resident had a chance to partake in that event, which was just great. So hope you all had a great New Year's Eve through the lens of this event. This event is actually one of many events that we planned because of the 25th anniversary. And so I'm gonna pedal back a little bit here in the next week. We are gonna author a memo about the 25th anniversary, the events that we have facilitated since September, and then all the way through the Gatsby event, and then what's to come in January all the way through September of this year, which is our formal 25th anniversary month. So look forward to that memo and a listing of all the events here in the next week. Any other questions come in? Before I turn it over to Reverend Florence. One question came in: will you be testing residents and staff in healthcare? And the answer is yes, we will. On the 14th, will you be testing residents? Oh, right, we are testing residents. I'm sorry, because we have a positive, two positive cases in healthcare, we tested every resident and team member today, which is part of our protocol, since the two tests came positive last night. And so every team member that works in healthcare and every resident that lives in healthcare was tested or will be tested. They're probably finished by now, and those tests are being evaluated. So there was a question that came in about trees from Monday. The trees that we're planting from Cedarfield Parkway down to the pond. You can see probably about 33 trees, I believe they planted on either side of that drive-through. The drive-through is there to be able to clean out at that edge of the pond every probably 4 years, clean out any sediment that rests right in that corner. We've been told that we can plant those trees along that drive, and that the equipment that is needed to dig out that little basin on the north side of the pond, the equipment won't be nearly as massive as they needed to use to dig out the project that we had here in the springtime. So it doesn't, from what they're telling me, it doesn't look like we're going to have to cut down any other trees again when we dig out the sediment. So, okay, any other questions come in? No questions? Alrighty. Reverend Florence Brooks is here to talk about spiritual well-being and share some great news.
Thank you, Michael. I think we've shared before that on Monday, Wednesday, and Friday mornings, our team has a morning huddle where we touch base with everyone across campus and find out what's going on. And Michael has invited the chaplains to share as part of that time. And this morning, I shared something and was asked by someone to share it with you this afternoon. So what I want to share with you is that research has determined that 50%, that's half, of our happiness is determined by our temperament. In other words, it's just the way we're made up. And the other half is determined by a combination of circumstances, attitudes, and actions. According to the lead psychologist who did the research, the 3 factors that have the greatest influence on increasing our happiness are, number 1, our ability to reframe our situation more positively. Number 2, our ability to express and experience gratitude. And number 3, our choice to be kind and gentle. So that's reframe positively, experience gratitude, and choose kindness and generosity. And so that's what I want you to think about this afternoon. If you're not accustomed to thinking and acting this way, it does take practice. So I would suggest starting with something simple. I think of my mother, who I believe is very skilled in this. And I can remember several years ago she was traveling and her plane connection was either canceled or delayed. Regardless, she had to spend an enormous amount of time in the airport. She was traveling alone, she was far away from home. She had to spend hours in the airport waiting. We all expressed sympathy for her situation, and my mother said, well, I'm just so glad to have a chance to rest and to not have to rush and to just look at all the people. I find airports so fascinating. I love people watching. So you see what she did there with the situation that many of us would consider rotten luck. She reframed it. She expressed gratitude for what was happening, and she chose to be kind to herself. So what can you reframe, express gratitude for today, and how can you choose to be kind and generous in the midst of it all? Think about it. It won't just happen. I wish you much happiness. We have some folks, I'm going to switch to good news. We have some folks here at Cedarfield who are spreading happiness. And that's our Cedarfield Readers. In December, our Cedarfield Readers had their second round of reading books for the kindergartners through 5th grade students at Fair Oaks Elementary School in Henrico County. The next project for the readers will be on Monday and Tuesday, January 25th and 26th. We're thankful for these Cedarfield residents who have been recording books to be shared with these young people at Fair Oaks Elementary via a virtual link. If you're interested in becoming a Cedarfield Reader, I encourage you to reach out to Martha Cole Glenn or Charlotte Bailey to see how you can participate. We express our gratitude not only to the readers, but to Martha Cole Glenn and to Charlotte Bailey and to Cedarfield staff member Katrin Soltis for their leadership in coordinating, recording, and launching the Cedarfield Readers. Thank you. We're so glad to have folks like this do things like this at a time such as this. Thank you all. Have a great afternoon and evening.